Welcome, everybody. Thank you for being here. We are delighted to have Dr. Ty Talcott with us today. He's a certified HIPAA privacy and security expert and president of HIPAA Compliance Services. He's a nationally known speaker and has spoken for us many, many times, and he's been a good friend to the GCA. Everyone, please welcome Dr. Ty Talcott.
Well, thank you for having me today, and everybody to pay a little attention this late in the day. I know most of you have been seeing patients all day, and that's a good thing. That's what we all went to school for, was to figure out how to use chiropractic miracles to keep mankind functioning at a better and better rate. The problem is we end up spending too much of our time doing this kind of stuff. So you're not going to find me to be a government compliance fan. You're not going to find me to be a government fan. But I am a fan of protecting you so that you've got the opportunity to utilize those chiropractic miracles and help people. So let's try to make the stuff as simple as we can. Today, we're going to blast through a lot of stuff. I know a lot of you are interested in the No Surprises Act, which came as a huge surprise to a lot of chiropractors. So we definitely want to hit that. Some of you might not realize that if you've had some kind of breach of information during the year of 2021, your deadline to report those breaches to the government is up in about 13 days. You have till the last day of the second month of the year following the complaint if you had less than 500 people breached in an incident. So if you've been under investigation or audit, or you've had a patient file a complaint or whatever, you have to have reported that to the government within the next 13 days. There's a whole lot of things under HIPAA. There's a lot of things under the ONC law, the OIG law, and all the other initials out there that a lot of people don't know and don't understand what needs to be done. So what we're going to try to do today is hit a lot of those at the 100,000 foot level, give you an overview of what's going on, make sure you know and understand a little bit about it and what your requirements are, so that you can then, if needed, you can get more and more detail. Now, we help people develop compliance programs. We also have tons of white papers available. We've got recorded webinars available that can help educate you. They're all free on a lot of these topics, and you can contact me at any of the addresses and information that you see here below. And we're glad to get you access to a lot of free information if you're trying to do this stuff on your own. Again, if you want help with it, we're here for that as well. But let's jump into some of the topics here, and we're just going to go full speed ahead. I'm going to tell you a little bit about me, not that you care, not that it makes much difference for anything, but there's a little bit of relevance, possibly. I actually had the first $1 million chiropractic practice. This was a long, long time ago when pterodactyls flew the earth and dinosaurs roamed throughout the plains. We ultimately about doubled that, averaged 160 visits a day for many, many years of the 20 years I was in practice. And why am I telling you all that? Well, because you'll see me live sometime for the GCA. You'll come up to me and you'll say, well, Ty, when am I supposed to see my patients? Doing all this other stuff. I don't have time to see my patients. I didn't go to school to be a documenter and a freaking compliance officer. And I get it. I understand. And so I try to develop my educational programs and my production programs such that it takes as little of your time as possible. Unfortunately, these are very complex topics. And things like HIPAA that we used to not hear much about, well, unfortunately, HIPAA equals healthcare cybersecurity. They're the same thing. HIPAA is the law that regulates what you have to do in the healthcare industry to protect your computers and protect your patient information utilizing electronic devices. And so now all of a sudden HIPAA's in the middle of the news constantly, and I'm getting about 2 to 4 chiropractors a month contacting me that are having problems, and we're having to deal with the government. They're under investigation or they're under audit, et cetera. Since that time in practice, I am and still do consult to chiropractors to build and develop practices. I'm not trying to solicit anyone into that business. I don't take new people in that business. It's the same group has been working with me for almost 20 years as their personal mentor. Why do I tell you that? I tell you that because if you happen to say to me, well, but Ty, you don't know what's going on out here in practice. You haven't been in practice for a while. Well, yeah, I used to run $1 million plus practice. Now I run 20 of them. So yes, all over the country, I am actually, fingers in the pie and know what's going on. I do know what you're up against, and I do take that into consideration when I try to teach or train. I presently teach and train for actually 45 state associations and 5 colleges. I need to update that slide. And right now we are the leader in compliance for chiropractors relative to helping people put programs in place. But let's bottom line a few things tonight. We got a lot to do. I want to try to bottom line the HIPAA safe harbors. There are actually some things you can do that give you a safe harbor almost a safe harbor against fines under HIPAA. We want to look at the No Surprises Act. We want to look at what happens if a breach occurs. We need to know how that happened and what to do about it. We want to take a quick look at OIG compliance. Since 2010, if you treat one or more Medicare or Medicare eligible individuals, you are required to have an OIG compliance program in place. That's Office of the Inspector General. If you don't, you are technically treating Medicare patients illegally. And if they find out because they investigate you or they run you through a major audit and they ask you to prove to them how you've been avoiding the issues they're auditing you for, and you say, what do you mean? And they say, show us your compliance program, and you don't have it, that's where they will discover you don't have it. And it can be very severe fines under Medicare. Medicare can actually fine $10,000 per line item. So you could have one patient that you've done 7 billing coding entries incorrectly. That could be a $70,000 fine on that one patient if they want to. And then we're going to do a little mention on the ONC compliance. That's Office of the National Coordinator. And you'll just see as we go along, there's a lot to do. So first, we're going to start with HIPAA just a little bit. How big is this law? Well, basically, HIPAA has 2 parts to it. And so let's see what has to be done and what has to be kept up with. The 2 parts to HIPAA are this. I talk about it as you have to first install your HIPAA program. I don't mean install it in a computer program, or I mean install it in your office. You have to get the program in place. For most offices, this is going to be a 300 to 500 page HIPAA manual just to cover the basics that are needed. In fact, 100 pages of that manual in the typical chiropractic office are simply going to be the required formalized written policies that are required under HIPAA to meet those regulations. Now, if you install HIPAA correctly into your office and you're going by the law, which is about 1,500 pages, by the way, of law, as you do this and you install each section of that program, the law tells you that there will be a specific time you have to either formally evaluate, formally review, that means documentation, or actually conduct a self-audit relative to that section of the HIPAA law. So in other words, if we're looking at a requirement under HIPAA, which is to have a risk analysis, it will tell you in the law that once a year you have to update that risk analysis unless you've added an electronic device or subtracted an electronic device from your inventory and updated at that time. Well, what does that mean? Well, it means that when you installed the program correctly, you were told what you have to do to update it. If you then don't do that, there's about a dozen reviews, evaluations, and self-audits that have to be done every single year, year after year, or your program's not current. If your program's not current, it means you knew what you were supposed to do because you implemented a program and you did not do it because you didn't follow it up and do what you were supposed to do. That under HIPAA is called willful neglect. Willful neglect is a minimum $59,255 fine. So these things can be very, very significant. In fact, in our programs that we install programs for a doctor, but then, and we have audit schedules that go with that and explain to the doctor what they need to do to follow up those dozen or so per year. And that means you have a one-time expense to put a HIPAA program in place. You never have an expense again because we give you updates for free. But then every month we've told you what to do. But we also have a program called an MMM, Mandatory Monthly Maintenance Program, where we actually do that stuff for you every month. Because what we found is that chiropractors, when they finally understand they've got to have the programs in place, they'll do that. But then they won't keep them current. And then they end up in all kinds of trouble. So we got to have both sections to this. So your HIPAA regulatory compliance manual, if we just look at what would a HIPAA manual look like? How broad is this law? Well, the best way I found to do this very quickly is to show what the table of contents of a good HIPAA compliance manual would look like. And if you figure it like this, every number that you see come up there that's got writing on it, figure that's a tab in your manual. And then there's some level of documentation behind that tab. Written policies, written procedures, forms that you need, contracts to sign, whatever it is. Then you can start to see how this manual gets big and thick. But you have to have a compliance officer an actual job description that they have accepted in your office. You have to have your notice of patient privacy policy template in the manual. You have to have any and all forms that you use relative to HIPAA and monitoring HIPAA, following the rules and regulations. You have to have an accounting log for every single patient that shows where you have sent their information out of your office. This is outgoing only, not incoming information. So anytime you send anything out of your office, you have to have an accounting log that says who wanted it, what it was, why they wanted it, what was actually sent, when it was sent, etc. And that's required to be able to be produced per patient if the patient wants to know where their information went. That does not include every time you file an insurance form. Insurance companies are under HIPAA. They must follow HIPAA regulations, and you do not have to log that. You need your corrective action forms in here. You need employee confidentiality statements and all the signed ones. You need business associate confidentiality contracts. These are required for anyone that you give your electronic data to, or you allow access to your electronic database. So IT person that works on your computer when it crashes, you've got to have what's called a BAA, a business associate agreement, which is a business associate confidentiality contract. You have to have that in place, or anything they do wrong, it's your fault and you will be fined. If you have an outside biller you're using to give them information, if you give your information to a shredding service and they're going to shred it, that's paper as well as computer, you have to have these signed and in place to protect yourself. You're required to do an annual in-service or training regarding HIPAA for, even if you're a doctor with no staff, you have to do it for yourself and record and document that you did it. It's not enough to do it. You have to have documents showing that people signed in, that they were present. You have to have a disciplinary policy in place of what you do if people don't follow the things that they were taught and trained. You have to have a detailed outline of everything that you trained. It's not just simply, oh yeah, we did a training, we're okay. It doesn't work that way. You have to physically audit your physical plant every year. This is about whether charts are laying around, whether people can see your computers, et cetera, et cetera. It has to be an actual formalized audit. You have to have a risk analysis. Every year I go to the Washington, D.C. Cybersecurity and HIPAA Symposium. This symposium is put on by the Office of Civil Rights. If you mishandle a patient's information, you have violated their civil rights. That's who comes after you, is the Office of Civil Rights, in conjunction with their partner called the Department of Justice. So they can pretty well do what they want to do if they want to do something. Every year, I'm the only consultant there, 9 years in a row. There are people from the insurance industry. There's people from Homeland Security. Healthcare cybersecurity has now become a national threat. There are people there from the Federal Trade Commission. There's people there from Health and Human Services, the Office of Civil Rights, CMS, Center for Medicare Services, and they're all there. There's people from the insurance industry, the hospital industry, but no consultants. And what are they doing? They're all there talking about who they're after, how they catch them, what they do to you when they catch you, how they catch you doing things you didn't even know were wrong, the things they don't care about, the parts of the law they're not enforcing, and what they see coming in the future. Now, let me ask you a question. If you want somebody actually teaching you HIPAA and helping you with HIPAA, do you want somebody who knows that information straight from the horse's mouth, the actual enforcers? I sure would, but there's not another consultant there. Why am I saying that? I'm saying that because I get this all the time speaking live. I usually do 20 to 30, sometimes 35 live events a year. So I'm in front of chiropractic audiences constantly, and I get the same questions from the audience. And they'll say things like, well, I have a HIPAA program, but I never heard of a risk analysis. Or I have a HIPAA program, I never heard about a security reminder, which you're supposed to issue to your workforce every single month, a security reminder. I never heard of that before. Well, you know why? Because the only place they have announced unless you are issuing security reminders monthly, they don't consider you compliant. That's what they have found at every investigation they've ever done of every doctor. That's not in the law. So unless you were sitting at that symposium and heard it from their mouth of what they actually do, you wouldn't know to put that in a HIPAA program or to teach or train that in a training program. So yes, you may actually hear me say some things that you end up going, I've heard about HIPAA a couple of times, or I've been to a couple of seminars. I've never heard that before. I don't doubt that at all. I don't doubt that at all. That concerns me about the preparedness of the chiropractic profession. I am a chiropractor. I teach and train chiropractors, and I also get the calls from y'all when you're in trouble. And I act as a go-between between the chiropractor and the government on an ongoing, continuous basis. I'm not an attorney, but so far since 2010, we've been able to handle every complaint and get everybody out of fines without having an attorney involved if we've got the stuff in place. I cannot emphasize enough, it is about prevention. We are the profession of prevention. We need to be doing that with compliance. You got to have a risk analysis every year for the last 7 years in a row that I've been there. They have screamed and yelled. We don't know what else to tell doctors, but if you don't have a risk analysis and you don't have recent ICERs, you have no HIPAA program at all. No matter what else you've done for HIPAA, it is negated. It does not matter when it comes to fining you the maximum. In other words, you can get in trouble for not having all the other things under HIPAA. And you can get in trouble for not having a risk analysis or ICERs. But if you get in trouble for anything else and don't have a risk analysis and ICERs in place, they're going to fine you to the maximum. ICER stands for Information System Activity Review. And while we don't have time to go into what that is and how it works today, I will tell you this. It is the only way performing an ICER, an Information System Activity Review, correctly, which again, I'm sorry, we don't have an hour to do it today. But unless you're doing that, you have no way to know if someone is stealing information out of your computer without you even knowing it. It's the only way to know. The largest breach in history was 80 million people breached via Anthem Insurance Company. And the reason that 80 million people could be breached was they weren't doing ICERs. It took 11 months. They had information being stolen for 11 months before they discovered it. Had they been doing ICERs, they would have discovered it in the first day or the first week and probably had 1 million people instead of 80 million breached. And that's why the government is trying to force you to do these. You're also required to do an annual A to Z HIPAA audit. What's that? That's an audit of your audits. That's an audit that audits whether you did those dozen reviews, evaluations, and audits I'm talking. They're serious about this. They're having you audit your audits. This all has to be written and documented every year. It's not so, oh yeah, we did that. No, won't work. Not going to talk about bonus audits. Policies and procedures. Again, about 100 pages are just formalized policies. And then you have to have a required contingency plan that has a data recovery and emergency mode operation plan. Now, that's a quick overview of what makes up this 300, 400, 500 pages as a start. Now, understand something. A HIPAA program is something that develops and grows over time because you have to do these dozen or so reviews every year. There's a list of all the policies. Those are the policies that take up 100 pages to have under control. Now we're going to skip to a new topic, but it's still under HIPAA. I know we're going quick. Civil rights director in 2013 said, hey, you know what? The idea is this program is we fine you, collect the fines. Those fines have to, by law, go back into enforcement. So what happens? They collect fines, they enforce more, and they collect more fines and they enforce more. He says, no, I see these articles saying more audits are coming. Well, you better get ready. That's what's really happening. It is. They are now, this is 2013. He was saying this. They are now doing random audits. Random. And their stated public policy is to eventually audit every single doctor. So I didn't do anything wrong. Doesn't matter. Doesn't matter. Malpractice carriers now say you're more likely to have a significant financial impact from a regulatory fine than a malpractice suit. That puts it in some perspective. We got to talk for a minute about what's called ransomware. Cybersecurity is critically important. Ransomware is when your computer is attacked, you come in, there's nothing on your computer screen except a screenshot that says we have your data, and it'll say something like, you've got 5 hours to pay us $8,000 in Bitcoin. We'll show you how, or you're never seeing your data again. If you don't do that, well, then you got 15 more hours to pay us $20,000, or we're going to sell your patient's data on the dark web. We're going to extort your patients. We're going to destroy the hard drive on your computer, all things they can do under ransomware. And it's a HIPAA violation. It's an automatic $59,255 fine. And on average, it cost $158,000 on average to solve this problem. We have chiropractic offices that have gone out of business, just closed the doors, versus solving this problem. And it is the most common panic call I get from chiropractors today. This is the most common thing you're getting hit with, is a ransomware attack. And I'm not going to go into all the details of how I managed to get this video of this chiropractor, but I'm going to actually show a video, if it will work for our technology today, of a chiropractor who was attacked by ransomware, so that you can hear firsthand from a peer what this is like and why you need to get everything in place and protect against this. So let's see if we can take a listen to her.
Okay. Well, Dr. Levitt, why don't you go ahead and tell us a little bit about your experience, kind of some of the things you've been through, how long you've been going through them, and some of the hassles that come up when this kind of a ransomware attack hits.
Okay. As Ty said, my name is Dr. Kathleen Leday, and I am a chiropractor up in the Pocono Mountains. And we never thought that we would ever have been in this situation. I have a small practice up in the mountains. And in March of this year, we came in and we had one of those messages on our computer. And it had all of your files are encrypted. And if you want those back, then you need to contact us via an email. We will tell you how you need to purchase Bitcoins. And I never knew what a Bitcoin was. And it would depend upon how much money it would cost us, depending upon how quickly I responded. My husband is in IT, and I called him and we were freaking out and didn't know what was happening, didn't even know that it was a ransomware attack at that point. He told us to shut down all of our computers. That took us about a week of not having any computers, no schedule, no files to go back on. So that was just the beginning. Then we ended up having to go, we had to report it to the internal Internet Crime Complaint Center. Never even knew that we had that. We ended up having to go through a forensic report. And as Ty had said, going through the forensic report, for us, they determined that they did get in through our remote access port. We had shut that down to make sure that there was going to be no other breaches. But it took about a month and a half for them to determine that, yes, there was a potential of exposure of our PHI. But because it was a potential of exposure, we now needed to make sure that we contacted Health and Human Services. We also needed to figure out how many of our files were encrypted, how many of our files were potentially exposed. Ours was about 530. Anything above 500, you have to report to your local community. So then we had to put a legal public notice in our local newspaper. With being able to contact all of our patients, figuring out how many patients, again, were affected, that was a lengthy process, because then we had to go and we had to do reports, we had to make Excel sheets, we needed to send it all over to them. Once we ended up going through and reporting it, then Health and Human Services had contacted me, verified all of the information. Now the investigation started. So about 6 weeks later, we ended up getting a letter explaining that we were under investigation, and there was 24 questions that we needed to go through and answer. A lot of the stuff that Ty's going to be going over today is what they were asking us, what a risk analysis, a disaster plan. Not only is it the risk analysis, but what, how often are you doing the risk analysis, your risk management plan, audit logs. You know, can you determine any of your staff when they log on, when they go off? Do they delete anything? So this was beyond what I ever thought I would have ever be experiencing. But once we've done that, we handed over, it was about 9 pages of information of me answering the questions. Then we had gotten back a letter stating that the one thing that they were concerned about is that I didn't have a risk analysis. Now, just like you, I would think that we do everything informally. I have a small practice. I only have 2 employees and myself. So everything in our practice is informal. We needed to have formal written policies that we can prove to them what we have done. Now, malware, we had Windows Defender, but we did not realize that the malware, you had to bump it up to the premium plan because that also goes through and checks for ransomware. So we've done that. So we had to prove to them everything that we have been doing to prevent from this happening again. It is December. I'm still going through this. And when they were telling me that I had about 30 days to contact them and tell them what my risk analysis plan is going to be, I kind of freaked out because it's like they sent me all the information. When you sit down and you read it, it's so vague. You have no clue as to what they want. And that's why all of a sudden the PCA had sent me an email stating about the webinar that Ty had. So I went on that, and then I have personally purchased his silver program because we don't have the time to sit down and create our whole HIPAA manual and all of our risk analysis by January. So I'm working with Ty and Tiffany to create that. But it is extremely nerve-wracking, and we still don't know what the results are going to be. But if I tell you anything, I was one of those who said, yeah, I have my HIPAA manual, but it hasn't been updated. Let me tell you, now every single day we go in our office and we're looking around for potential things that the personal health information can get out. It's not only electronic, but it is paper. A lot of extra hours beyond what I'm already doing with treating my patients. So if you think that just because you have a data breach, it's over and done with after you contact all your patients, that was just the beginning. And it's the investigation that you really have to be worrying about. And it's like looking at every single thing in your practice to determine whether or not you're HIPAA compliant. And you have to have not only the risk analysis, but you have to do that all the time. You have to prove that you're training your training your staff on the HIPAA regulations. So for me, this has been a godsend to be able to come and to take Ty's course. And then also, again, for me, I needed to purchase one of the programs just because we're getting worn out. We don't want to have to sit down and spend hours upon hours deciphering what the government wants you to have, but yet really doesn't tell you how to go about doing it. So.
Now, I think that expression right there sums it up. I mean, you go into practice, you want to work with chiropractic miracles, get people well, and here you are a year later, still fighting with the government. They've already said they're going to fine her. They just haven't said how much. Now, usually I would tell you a whole lot about what we did with this situation, but I'll just tell you the bottom line on it today. What we did was we created a full entire HIPAA program for her. We took the breakdown of the questions that the government wanted answered of what she was going to do in the future to assure these things didn't happen. Again, what we did was I took a roll of electrical tape and I took the whole entire program, and their question number 3, I put a big giant 3 in black electrical tape on the manual where it covered in depth how we were handling their question. And on their question number 7, we took the electrical tape and put a giant 7 on top of it, and we turned that whole thing into the government. The good news was we thought it'd be a long time till we heard from them because they're very slow. She actually got a call within a few days. They said that was the best corrective action plan they'd seen, including the ones they get from the hospital. So that was a good start. The very next week, we got a letter from the government saying that due to the voluntary actions taken by the clinic that was putting together that corrective action, they were going to close the case. They didn't fine her at all. They reversed their decision and closed the case with no fines. That's the way you want to get out of it if you can. Here's the difference. It ended up taking 13 months. It ended up with a $20,000 forensic investigation to produce the information. It ended up with having to monitor the credit of patients for a year that were involved. There were 500 of them at $10 a month per patient. That's $5,000 a month for a year. Now, we managed to get some of that reduced, but we still had some costs in there. So there were all kinds of costs. There was all kinds of time. We managed to miss that $60,000 HIPAA fine, which was nice. Bottom line is this. had the program been in place, first of all, the ransomware attack never would have happened, because HIPAA programs are designed to prevent that. That's why it's an automatic HIPAA violation if you have a ransomware attack. Secondly, when they demanded what they demanded from her 11 months earlier, we would have been able to deliver it. And if we can deliver what they're demanding, they close the case almost every time within a few weeks and no expenses. So even though we have been, knock on wood, successful at even getting people out of fines that have a problem and have an issue and have no program in place, the difference is it can take a year to a year and a half and cost $20,000 to $80,000, or we can just send them what they want and be done with it. I don't charge to represent someone to the government and do anything I can to keep a chiropractor out of trouble, whether it takes me an hour or 40 hours on that case. I don't charge for it. So that 80 grand, 20 to 80 grand is not coming to me if there's issues. It's going to the people that we have to produce the reports that the government is demanding on a very short time frame. That's where the issues come in. So again, prevention, prevention. My main message to you today on this is, with ransomware and the sophistication of theft, it's not just about avoiding government fines anymore. This can shut your practice down forever. And that's what we're trying to do, is keep you in practice. So let's jump over to the No Surprises Act. We need to spend a few minutes on this today. I know it's got a lot of people surprised, a lot of people upset and not knowing what to do. And for good reason. There are several lawsuits against this act. This new law has several lawsuits against it. Why? Because it's craziness in a lot of ways. But we don't know what those lawsuits will and won't change. So as of January the 1st of this year, we need to be compliant, and we can change our compliance if the law changes in some way. Now, one of the reasons it was very confusing in the beginning is that a lot of people only read the first part of the act. And in the first part of the act, it says this act applies to facilities that are in network, that have surprise bills issued to patients because they have some services or practitioners that are out of network, that the patient got an unexpected bill. Well, if you stop reading the law right there, because it says who it applies to, that's not a chiropractor, right? I mean, you might have a chiropractor or two that work in a facility like that, or you might have a chiropractor or two who own a facility like that. But 99.9% of all chiropractors, this law would not apply to them. The problem is there's a part 2 to the law, and people didn't keep reading because they got that first part and just dismissed, why read hundreds of other pages of law if you don't have to, if it doesn't apply to you? But you got to read a little further. So let me real quickly summarize that first part that doesn't probably apply to anybody on the line or probably anybody that'll see this video, but I'll tell you very quickly. Nobody likes this when this happens. I went in for a knee surgery. I know what they're talking about. The surgical center says, yeah, $3,800 for your knee surgery. Then I go in, I have a very successful, wonderful knee surgery. In fact, I was on a plane with my luggage to do a live event 7 days after the knee surgery. I was thrilled to death. Till a month later, I got a bill from the radiologist, a bill from the anesthesiologist, and a bill from the lab, all totaling about $1,200 that I was never told about and wasn't under my insurance. That's called a surprise bill. Nobody likes that. Understand the intent of this law. It's critical to understand the intent of this law, because when we do talk about the part that applies to chiropractors, we actually, many of us, cannot meet every technicality of this law, but we can't just shut our practice down. So what does that mean? Well, my staff attorneys have always told me that if you cannot meet the technicality of a law, but you meet the intent of the law, it is very difficult for anybody to find fault with that in any meaningful way, like fining you. Okay. So you're going to hear some areas in a minute and your sphincters are going to tighten and you're going to go, oh, I can't do that. That won't work. I'm going to talk about some ways to meet the intent of the law where you can't meet the technicality. But this law, the intent is to avoid any patient ever getting a bill for $400 or more that they didn't expect. $400 or more that they didn't expect. So if later, when you see some things you're supposed to do and have to do under the law, if you can't do them, but you can still make sure your patient doesn't get a bill for $400 or more they didn't expect, you're going to have in all likelihood met the intent, and we can keep you out of fines if you get in trouble. By the way, if you ever get in trouble, do not open your mouth to the government. Do not call them on the phone, and do not send them an email or a text. You call me. The biggest problem I've got for most doctors is getting them out of the poop they already stepped in. The last thing you want to do is, oh my gosh, I didn't know. Ignorance of the law is no excuse. You just admitted. We have time to respond to these types of problems and allegations that could come up from compliance issues. There is nothing says you have to respond today, tomorrow, or in the first week. So get a hold of me. I will walk you through it. It won't even charge you. I will walk you through it. We got to keep the profession out of trouble. The easier target we are, the more they're going to hit us. Okay. We need the profession to be out of trouble. So one suggestion I'm going to give you right now, this is totally my opinion. You know, the law is so much the law, but when it's my opinion, I'm going to tell you, it's my opinion. If you will set your standards in your office such that you always tell your patients what your fees are, they always know the fee before a service is rendered, and they always know an estimate of fees if you do programs of care or make recommendations above and beyond, you know, today's visit, tomorrow's visit, that you've always given them an estimate of what that cost is going to be, then the likelihood of you ever having a problem under this law is very, very small, because the patient can only file a legitimate complaint against you if they got a surprise bill of $400 or more that they didn't know or expect. So if you just don't allow it to ever be that a patient comes in and you go, well, we need to get some x-rays on that. You take them back. You don't tell them what it's going to cost. They come to your front desk and it says, well, that's $550. They could have a legitimate complaint. Or if that bill came later in the mail, they could have a legitimate complaint. If you don't just ever have a situation that allows that to happen, then you've avoided the majority of your problems. Now, a disgruntled ex-employee could still turn you in for not being compliant. A peer could turn you in for not being compliant. There are other ways people get caught at stuff, but the main way this law ends up fining you is a patient complaining. And so if we just don't give them a way or a reason to complain, then you've solved a lot of the problem. Now, you still need to have this compliance in place, because again, you could have ex-employees turn doctors in. I mean, it's unbelievable. I had 3 in 1 week in the month of July. 3 doctors, chiropractors, panicked. I got this notice from the government. I'm under investigation because an ex-employee turned me in. 3 in 1 week. This happens. Your CA is your best friend till they're not. And you get crossways and somebody gets mad and fires somebody, or somebody gets mad and quits. They go to work in another health facility that's teaching Hipaa correctly, and they realize, oh, that's what I work for. They weren't doing that, and they turn you in. Okay, part 2 of this law does apply to you. Part 2 is requiring you to give a good faith estimate of the cost of care to a patient who is a self-pay patient. Now, I want you to hear this. This is only about your cash patients or your patients that have insurance and have elected to not use their insurance and pay cash. Now, one question always comes up, well, what about an injury case where I've got a lien and the insurance doesn't pay, the attorney doesn't pay me, but now all of a sudden the patient owes the bill? Are they a self-pay patient or what? This is a hard question to answer. So I'm just going to tell you, most states are in charge of regulating work comp and PI. Work comp and PI patients seldom fall under any federal law. It is usually state law that regulates those requirements. I would say, personally, if I were still in practice and I had patients that were injury cases like the old days that I did have liens, I would still give that patient an estimate of their care, tell them that the insurance attorney is supposed to pay this. That's what the lien says. But if they don't, you're going to be responsible, and here's how much it is. I would still do that. That makes it perfect. You're like rock solid at that point. Otherwise, it's a risk. You got risk in there. But it says in the law that Medicare is not included because Medicare patients have other protections against these kinds of things called the ABN form. And if you don't know how, or you're not using an ABN form with your Medicare patients, then good luck. You're going to eventually get nailed. If you're doing Medicare, you need to know and understand ABN forms. I got free white papers, free webinars on it. We'll get you any of the stuff you don't know and you want to try to learn it on your own, good luck. But if you do, we've got resources for you. We can help with that. They don't cost anything. Okay, so we've now isolated that these are patients who are paying cash or have insurance but decide to pay cash. This applies to every patient of yours after January 1st of this year. That's not just your new patients, returning patients that are cash or have elected to not use their insurance and pay cash. This law applies to them. So what do you have to do? Again, if you don't do what you have to do and the patient complains, what can happen to you? Well, what can happen is the fees that are owed to you go to an arbitration committee that has been created under this law, and they decide how much of the fee, if any, you can have. And they can also fine you $10,000 per violation if they find that you're being compliant, but there's still an issue. Then they're going to determine what part of your fee you can have. If they find you're having an issue, but you're also not compliant, then the chances are they're going to fine you for being non-compliant. And that's where the big bad problems can come in. So again, only cash patients or patients who are choosing to do it. It has to be a $400 or more surprise bill, and the patient has to file a complaint unless someone turns you in for being in violation. They got to file the complaint within 120 days. Now, here's where it gets very bizarre, and you're not going to like it. What about this good faith estimate? Well, first of all, there is not a required form that you must use and fill out to give them this good faith estimate. It has to be given to them in writing. You have to verbally tell them and give it to them in writing. There is not an official form that you must use. However, the government did create some forms as samples that you can use. Now, we got a hold of those forms, and quite frankly, they're way too complex for the typical chiropractic office. We modified them. If you want a copy of the modified forms, I'll give it to you. Just email me and say, hey, give me those forms for the good faith estimate under the No Surprise Act, and we'll send you one of the forms. You can use it or not. It's not required under the law. We just think it's a much more simplified form than they've got. So here's what has to happen. They actually have time frames on this thing. So you have to give a patient a verbal estimate of what their fees are going to be on your first visit and a written estimate 10 days before they arrive at your office. What? How many people call you 10 days before they want to come in? Obviously, we can't meet that requirement typically. So there's an option. Then you have to do it. If they make the appointment within or coming in within the 10 days, then you've got 3 days to get it to them. Well, that doesn't work either, right? You have patients call in the morning. Oh, I'm dying. I got to get in there this afternoon. Well, then you've got 3 hours. Well, what if it's 3 hours from now and they don't have access to an email, or you can't get a courier to give them your written estimate? What are you going to do? I'm telling you, there are times where you can't meet this law technically. Again, what is the government after? Nobody getting a surprise bill. So I would set up procedures. We have procedures we recommend if you're working with us and we're doing programs for you or whatever. But just as an overview, when a patient calls in as a new patient or whatever, especially, find out if they're going to be a cash patient. If they're going to be a cash patient, have a range of fees. Say, look, we don't know what it will. Here's what I like to be able to say. If I'm building a practice too, I like to be able to say, well, there's no charge for the initial consultation or preliminary examination with the doctor to see if in fact you are a chiropractic case. And if we believe that you're a chiropractic case and you're in the right place and we can help you, then the doctor will make recommendations, but you will not have any procedure performed till you know what the costs are and you have the ability to say whether you wish to continue or not. Now, that's a whole practice management issue, may or may not be right for you. You might not agree with it in any way, but that way a patient always, for decades that I teach this or something similar, have always known what their fees are going to be before the service, but you need to go another step further where you can. So now I would recommend that you find out if they're cash. If they are cash, you say, we don't know what the cost will be on the first visit because we haven't seen you yet. We don't know what your issues are. But the typical range, in the event that you might need extra diagnostics, you might need x-rays, you might not need x-rays, you might need this, might need the blah, 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 blah. The typical range of cost at a first visit for a patient, if we continue with you, if we determine that yours is a case that is a case we should be seeing, is going to be somewhere between $50 and $300 or something like that, where they have a range. And then if you can't get that written estimate to them ahead of time, it's too short of a window, have it ready when they come in the door with your other paperwork and just say, by the way, we talked on the phone. I told you it's going to be $150. If you'd sign this one here, blah, 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 and make sure they get it in writing before they do it. If that's as close as you can get, I think we can get you out of trouble. That's my opinion. We don't know. And I have a very strong feeling this is part of the law that's being sued. It may change, but I do believe we could get you out of trouble with that. If somebody ever complained, still, if it's not over a $400 bill, they don't even have a legitimate complaint, okay? If you have a patient that's having recurring fees, yes, we'll be seeing you, we're estimating it's going to take 20 visits, $100 a visit, it's going to be $2,000, whatever. Estimate those fees to them in your report of findings. You've now given them a good faith estimate verbally. Just have it written down what you're telling them and have them sign it. Now you've given it to them in writing. And then just make sure you manage your patients correctly, which you should be doing anyway. And say on visit number 3, you determine, look, we're going to have to get an MRI and do some other things. And these costs then are going to be, and give them a new estimate of what that change is. You've changed their program or what you're doing diagnostically, tell them what the cost is going to be. And if not, and you're monitoring through those 20 visits and you get around visit 16, 17 and realize this is probably going to take 25 or 30 instead, then sit down with the patient and give them another, say, and I know you're getting better, but we know it's slower. We've been talking about slower. We're going to need some more care. I'm going to estimate it's this much, written down, sign it, you're done. So manage your case, manage your patients better. And I'm actually doing, it has nothing to do with y'all, but the people that I help with their practices, I'm actually doing a seminar this weekend with them. And one of the things we're doing is we're taking the No Surprises Act and we're making sure that in our new patient, especially our new patient procedures, our report of findings, our first visit, our report of findings, that we're now tweaking it just a little so that we incorporate enough that it meets all the criteria of the No Surprises Act on top of what we've always done, which is tell patients what it's going to cost and give it to them in writing as well. It's just good. This is what we do to build practices. Understand, these are the things we do to give patients confidence in sending their friends and their family that they're not going to be surprised with a bill. They're not going to be ripped off somehow. Everything's out there. Everything's in the open. This actually builds practices. So if you got to be compliant to something, but you can figure out a way that while you're being compliant, you're also growing your practice or making it easier and more fun, or both or all, why not? Why not? So again, it is a complex law. It is being sued. It will likely change. And again, we have a whole recommended process, several steps to go through, and I'm more than happy to get you that information as well, and more information about any live events that come up. I'll put you on what's called my alert list, where I put my clients where any changes in the law or changes in what we're recommending, we put it out for free to our clients over the alert list. Now, if you're a client, we actually do it for you as well, but we put the heads up, here's what's happening, here's what you need to do. And you can, I'll put you on that list for free. So you at least get a heads up, what's going on out there. Because if you're not plugged into something, how do you know this stuff is even happening? I mean, did you know about the No Surprises law until somebody happened to surprise you with it? What about the other two? What about the OIG compliance I talked about earlier? What about the safe harbor laws under Hipaa? Under Hipaa, before President Trump left on January 2021, he put into place a series of requirements that if you do these in your office on top of Hipaa, then if you get a Hipaa fine against you, it'll be released. You won't have the fine. But you have to have these new things in place for 12 months. So it went into effect January of 21. Well, that means if you started in January 21 doing the things you're supposed to do and did them for 12 months, right now, you'd be virtually immune to HIPAA, short of doing something criminal or conspiracy. Really, it's not a 100% safe harbor, but they call it, even in Washington, they call it the safe harbor law. So this was an amendment to the high-tech law. And basically, you have to start now. How long are you going to wait? It takes 12 months to be effective. How much longer you want to wait? Let's do it now. Enforcement's on the upswing. It's going to get even worse after the pandemic ends. And here's what basically said: Health and Human Services, if they're considering an action against you and you have the safe harbor, then they have to take it into account. They have to take your cyber improvements into account. They have to have any breach into account. And you get some immediate protections and the others take 12 months to come into effect. And they must decrease the length and extent of audits and investigations. If you've done any of these things that are involved in the safe harbors, and again, at live events, we got time to go into all this stuff more, but if you've done any of them, not just all of them, any of them, they have to take it into consideration and in essence, not fine you unless it's very extraordinary circumstances. Here's the great news. If you put a complete HIPAA program in place, you will have already met the majority of the safe harbors. If you do our HIPAA program, you will have met all of them. But I'm saying a solid HIPAA program already has these things in it. So I know it sounds huge to do all this stuff. It sounds like you just want to go to Costa Rica and raise chickens. I get it, but it's not necessary. It can be done. We do it constantly. It can be done. Now, I mentioned very briefly the OIG, Office of the Inspector General compliance. This is required if you treat one or more Medicare or Medicare eligible individuals per year. So PI practice, we don't charge their Medicare, doesn't matter, they're eligible. You've got to have OIG compliance program in place. Now, if you're just fighting some claim denials and things, you're probably not going to have a problem with this, even if you don't have it. The problem is if they get to a point where they truly audit you or they start an investigation against you and then you don't have it, they're gonna throw the book at you. This is the way you prove you were trying. If they catch you doing something wrong and you say, well, I didn't know I was doing it wrong and I was really trying, and you could prove what you were doing, I can get you out of those fines. But if you go, well, I didn't really know that I was doing that wrong, well, what were you doing to investigate yourself, to audit yourself, to self-police? And you go, well, nothing, then I got nothing. We're in trouble. ONC, that's the Office of the National Coordinator. So this is not HIPAA stuff, but it all builds and ties in with HIPAA. Office of the National Coordinator. This went into effect April 5th of last year. And this basically, bottom line, says if a patient says they want their records transmitted to someone electronically, another doctor or themselves or anywhere, you have to do it electronically. Now, if you don't have that capability, under this law, there are certain things you have to do and document in that patient's chart. So you either, if the patient says, I want you to send this by email or send this electronically, you either have to do it or you have to do specific documentation. Now, we don't have time to go into it today. I've got whole webinars on it. I've got a white paper on each of these individual things, have white papers on them that will help you know more details and work your way through them. I just want you to be aware of it because this could be a major fine against you. So I know it's late. You guys have been taking all day. You've been working your butt off, seeing patients. And so I'll say that on an official basis, we'll call this the official end of the official information. But if you'd like to stay on for a couple of minutes and hear what I do to make this easy in your life, I'll talk about 3 or 4 minutes about what we do and how we do all this stuff. Oh yeah, we do it for you. Wouldn't you rather have me do it for you? I mean, really, come on. You want to really do all this stuff, or you want me to? What if I told you, you don't have to worry about any of it anymore? Introducing the hands-off HIPAA compliance program. This is a done for you program. We do it for you. Any program that we install for someone under HIPAA, any way that we do it, we've got a couple ways of doing it. Any way that we do it, you get OIG compliance program, ONC compliance program, no surprises compliance program, all for free, all added on. And any other laws that come out in the future, this is what we've been doing since 2010. Before the ONC law came out in April, all of our clients already had it in place. No Surprises came out. All of our clients had it in place. We develop it, we distribute it out to our clients. There's no additional charge. We also have two components to our HIPAA and compliance programs. We have a way to implement them, and then we have a way to follow them up. When we implement, there is a one-time charge. After that, all updates forever are free. So you will have one expense on HIPAA, never have to put another program in. Somebody goes, this will be my 4th HIPAA program. Never goes out of date because we update it for free, and you never spend another dime on HIPAA. Now, because we give you all the updates. Now, if you want us to do those 12 things a year that need to be done, plus there's one thing a year on OIG, there's 2 things a year on No Surprises. If you want us to do those for you, we have another program. It's called MMM, Mandatory Monthly Maintenance Program, and it's a whopping $29 a month. So it could break the bank. There's no contract. You quit anytime you want. Just say, I don't want to do it anymore. That's fine. And any program we install, you get 2 months free of that MMM program to see if you like it or not. But if you don't like it and do it on your own, we give you the audit schedules. We tell you what you need to audit, how to do it. You can do it on your own. You'll never spend another dime on compliance programs. If you want us to do it for you, well, it'll be $29 a month until you say, I don't want to do that anymore. There are programs out there that charge $400 a month forever. There is no reason to spend $5,000 a year on a compliance program. There's no reason to have to do that. It is offensive to me, I'm sorry, to see that happen and to have people taking advantage of. And it's an online program. Oh, I want online program. No, you don't. I promise you, we started this as an online program. Everybody, that's what they wanted, and they hated it. You have to navigate a website. There's nobody to talk to or ask questions of. There's no human being you can get a hold of. Everything's automated into the site. And by the way, it's on my server. Who owns your information? I do. If you quit, you got to start over again somewhere. You pay this $400 a month to these other companies to it's on their server. They own you. If you go somewhere else, you have to start over again. You can do our stuff online if you want to, but you want a hard copy. There are times you want and need a hard copy that we deliver to you, and you want the electronic file it was printed from. You don't want it online. You want the document so that you can update it, change it, alter it at your leisure. It's your ownership. And that's what we do. So this program that we do is about helping you install and maintain with as little time as possible so you can focus on your practice, help your patients, keep them protected, and knowing you're in the strongest position you can be in. Here's what you get. You're going to get the manual. We author it for you. Your risk analysis, ICERs, the 100 pages of policies, the whole shoot and match. It's usually going to be 300 to 800 pages when we're done, and get ready to deliver it to you. We do this by sending you questionnaires that you fill out the information on a questionnaire. Then we take that information. We now know as much about your office as you know about your office for creating your customized, active, and dynamic HIPAA program. That's what's required under the law. And there are definitions of all of that. What's customized, what's active, what's dynamic. But once we've got, most people say it takes them about an hour to get us all the information we need, versus building it from reading the law, doing the law, figuring out what they want, then authoring your own stuff, which I did after I was certified and took 125 hours. I don't think you want to spend that time. It doesn't make any sense for you to spend that time, obviously. We have it for you in digital format and a physical copy as well when we're done. But I got a HIPAA program. Yeah, do you have everything we just went over? Are you issuing security reminders every month? Do you do a risk analysis? Do you have ICERs in place? Do you sign off on about a dozen reviews evaluations? Did you do those security reminders? Doesn't happen. Just doesn't happen in most offices. So the MMM, high accolades. Everybody loves that program. We've got your back guarantee. That means if you ever get audited or in trouble with the government, we're going to be there. We're going to do everything that we can for you. So far since 2010, we've never had to hire an attorney. We've been able to handle everything. And what's the value of this thing? Well, 100 of your hours at $100 an hour, that's $10,000 for the manual. You're going to spend 20 hours a month doing the checking for the monthly maintenance program to end up writing those all the resources you have to do. We've got the bonus OIG. We've also, I don't take people into my practice development group because I don't have time, and these people are long-term folks, but we do have a set of 12 manuals we've created that have a lot of the stuff we do to build multi-million-dollar practices. We're going to include that for free. That's $1,000 value. So good $19,000 value, I would say. It's going to be yours for $299 a month, period, and you're done, unless you do the $29 a month. And that will only be after you have samples and decide from there. During COVID, we had people that had time in the very, very beginning. Practices were closed. We had people with time and no money. So they had time to do their program, but no money. So we put in a program where you can pay $99 a month until the program is paid for. That's not $99 a month forever. It's the $299 a month for 6 months, you're done and paid for, or $99 a month until the program's paid for, then you're done. That's it. So if that makes it easy, you are welcome to do that. You can do the do-it-yourself kit if you want to. Walk yourself through authoring all of that information. Good luck. It's actually doable. It's not that hard. It just still takes time. And 50% of people who buy that kit within 90 days call us and say, just do it for me. I'm not getting it done. And please upgrade. So we give them, this is what the kit costs, and we give them a credit back for the kit. We take it, subtract it from the cost of the program where we do it for you. The program where we do it for you is called the hands-off or silver. Hands-off and silver. Silver was the old name. It's now the hands-off Hipaa program. Again, you're welcome to use the $99 per month option if you want to. If you want to get it over with quicker, then you do the $299 a month for 6 months. If you want to save $100, you can pay it all up front. But when you contact us, any of this contact information, we will send you an order form that has the options. You just order what you want, send it back to us. We're ready to go. All right, we went 2 minutes over, so I apologize for going 2 minutes over. But I think for now, you guys and gals have all had a long day, and it's probably time to go hit happy hour or go have a snack or do something. So I hope to see you all at live events in Georgia. I've done several, and I look forward to doing several more in the future. And I'll just say bye for now.
Dr. Talcott, do you mind if anyone has any questions? Could we open it up for a couple minutes for questions if anyone has any?
I am glad to stay for questions as long as people want to ask questions. I can tell you, I know I created way more questions than I gave answers. And anybody thinking about it is probably so overwhelmed they can't even pose a question. We see that all the time. But yes, I'm more than happy to stay as long as you all want.
So anyone who has a question, you feel free to unmute and ask it. All right, looks like
Put everybody into brain fry mode. It happens all the time.
Perfect. Well, thank you so much, Dr. Talcott. This was an awesome presentation. We really appreciate your time and your expertise.
I appreciate you. Thank you so much. Look forward to seeing you all soon.
Thank you. Thank you very much.